Thank you, Matt, and thank you, Sean, for having the conversation. Our next guest is here to talk to you because, unfortunately, talking isn't always enough. Naloxone is a life-saving medication that can reverse an overdose from opioids, including fentanyl, prescription opioid medications. Mark Barnes is a pharmacist, owner of RespectRX Pharmacies, is dedicated to respectful substance misuse and mental health treatment. He pioneered RespectRX, providing stigma-free services to those with mental health and addiction issues. Mark's work on the opioid crisis led to a fentanyl patch return to work program. Now a law in Ontario, he educates on addiction through naloxonecare.com and serves on the Overdose Task Force. Mark partnered with St. John Ambulance for a national opioid overdose prevention projects. His advocacy earned him multiple awards, including National Pharmacy Award and recognition from the City of Oshawa. He is a regional champion for Ontario's Naloxone program. RespectRX has trained over 200,000 people and conducted numerous seminars on naloxone use and opioid overdose. Please welcome Mark Barnes.
Thanks for having me. Thanks very much for having me, guys. Very important message, of course. I also want to recognize the previous speakers thus far. It's always overwhelming when you get the opportunity to speak, actually, not just people from the construction sector, trades, but anyone with lived experience. And that's so important. Whenever you drive policy, I can't speak to it enough that if you don't have somebody with lived experience driving that policy alongside with you, it's just not worth it. And that's important message. The message from the people who are struggling is the most important message. And that's important as we always drive policy forward. So today I got to speak a message about overdose prevention and naloxone. And people ask me all the time, Mark, how'd you get here? As a pharmacist, a guy who's probably the biggest drug dealer in the room, really. But how'd you get here? You know, certainly. And this is a very dark topic. The topics so far have been dark. It's a mental health struggle. We're in a crisis. You know, it's an opiate epidemic where I think the numbers now are probably up over 50,000 Canadians, actually, if we're conservative. You know, people are struggling in the darkness. And I want you to remember is the key message from this presentation. Take these messages, move them forward. But there's one thing you grasp today when you leave here, right, is that every person has a struggle. It's a mental health battle. And if you think that you're better than that person just because you don't have it, you're wrong. We're all equal. Every family struggles, and that's important. We all know somebody. 50,000 Canadians, it's a lot. The rate is actually twice as bad as the United States. So any of you guys who watch those documentaries, Dope Sick or The Pharmacist, Painkiller, come back home to Canada and realize our problem is twice as bad. Okay, so you know what? Even though we live in a country we're very proud of, we got a lot of work to do here, and it starts today, right? And that's important to note. Okay. So who am I? What am I talking about? Opioids. You know what? Let's take a step backwards first and talk about opioids in a way from a pharmacist's perspective. Let's give you some skills, some learning. I recognize that many of you aren't health professionals like myself. So really, I'm going to take off my, substance misuse hat and tell you that opiates aren't bad medications, because they're actually not. We actually can't do modern medicine without them, and they're never going away. Despite the lack of primary care, the lack of urgent care in our country, deprescribing by physicians, everyone sued the pants off Purdue Pharma. Am I even allowed to say Purdue anymore? I don't know. They're never going away because we can't do modern medicine without them, unfortunately. But they should be reserved only for advanced acute pain, such as falling through a roof. Absolutely. Don't feel bad that you were given morphine pallet. You needed it, 100%. Okay? We can't judge that. The second reason we need opioids for, guys, remember, is to put you to sleep for surgery. How many people have ever had surgery? Raise your hand. Okay, you're all fentanyl users, okay? If you think about it that way, that's really what it is, right? Really, we use fentanyl to put you to sleep for surgery. Now, there are two main sources of opioids in our society. We have to remember that. We talked a lot about medicine, myself, right? I'm the gatekeeper of opioids, and all the names are there for you. There's tons of them. Hydromorphone, morphine, codeine, OxyContin, Percocet, Tramadol, Tramacet, Nucenta, blah, 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 blah. I can keep going. There's tons. They're never going away. But there's always also been another nasty street source of opioids been out there forever, right? Now, when I started this business 10, 15 years ago, I recognized early in the early days of our company at RespectRX, that we had to open early. 6 a.m. We could never close. We've been open every single day since October 1st, 2013, right? In all of our locations. And we close late. Why? For the construction sector. Nobody works longer than you guys. So we had to work longer. Because there's always been a nasty street source opioid out there that everyone's been consuming. We've recognized early that the problem, the prevalence in construction has been around ever since the new data. We've been recognizing it for a long, long time. 1 in 3 people who die of an opioid overdose in this province who have a job are from the construction sector. That's why we're open early. Now, this nasty street source has been around a long time before we even thought about the more trendy OxyContin and the promotion of those drugs, was heroin. We all know what that drug is, heroin. Now, advance to 2024, where we are today, and heroin is done. It has been replaced with street source bootleg drug den fentanyl. Different than the fentanyl you get an epidural for childbirth. Different than the fentanyl you'll get to put you to sleep for surgery. This fentanyl is street source, powdered form, various colors. The color doesn't matter, it's just food coloring. Made by the street for the street. Why is that such a shift and such a problem over the last 10 years? It's simple. Fentanyl is 100 times stronger than heroin per milligram strength. It's a big problem. Now, the guys who package it, make it, sell it, they don't have access to proper pharmaceutical technique. I'm not on their staff, though people tell me I am. Okay? They're not making this stuff at Health Canada down the road here in Ottawa at their health labs with pharmacists and quality assurance techniques. They're making this stuff primitively, with primitive glassware in crack houses all over our country. So they can't make a consistent form of it. They're making all different versions known as analogs, and they are strong and full of garbage. Some of the analogs we see now are arc-fentanyl, carfentanyl, fluorofentanyl. These analogs can be 100 times stronger than fentanyl. So if you think about it, our toxic drug supply in just 10 years in this country has gone from an OxyContin heroin problem to a carfentanyl problem, which now can be up to 10,000 times stronger per milligram strength. So that leads to another nasty problem that we keep forgetting about. Despite people consuming opioids more than we've ever seen in history in this country, we also have a non-opioid street drug issue as well, where every other street drug out there really can be accidentally cross-contaminated with these opioids. So though if your site isn't really prevalent in opioids, right, it doesn't really matter anymore. People die of opioid overdoses, and they didn't want to take an opioid in the first place. That's an issue. We find this stuff in Molly, ecstasy, crystal meth, crack, cocaine, speed, shrooms, and even street-sourced non-government supply cannabis can be cross-contaminated with opioids. So the message from any public health authority across this country, from a pharmacist like myself, who just has a shop down the road, probably the closest pharmacy to this conference, is never use that substance alone and always carry the overdose prevention resource Naloxone. Simple. Now, what is an opiate overdose? What's actually happening to the body? I recognize, again, you're not health professionals, so I'll keep it easy and simple for you. I mentioned to you earlier we use high-dose opioids to put you to sleep for surgery, right? So think about opiate overdose as going to sleep for surgery. Time for your knee replacement. Count backwards from 10, 9, 8, 7, you're out. Welcome to the wonderful world of opiate overdose. Really, simply put, for anyone who's a physician here, the study of anesthesiology is putting you into an opiate overdose so I can do that knee replacement on you pain-free. Now, the first things that doctors and nurses will do in that preoperative procedure when they give you the opioid and you lose consciousness is they'll intubate and ventilate. They'll hook you up to a machine to keep you breathing during surgery. Why? That level of opioid in the body, which is not even as much strong as what's on the street, does not just kill pain, does not just sedate for surgery, it acutely stops breathing. So what is an opiate overdose? You stop breathing. Simple. When I teach this to grade 8 kids, I always get the loudmouth grade 8 kid to come up to the front of the class. That was probably me. And I said, come up here. And I give them a plastic grocery bag. And I said, place this over your head. And they give them a roll of duct tape. I said, tape it around the neck. They're like, I would never do that. Then I'm like, why would you take fentanyl? Same thing, right? Your body's overwhelmed with the opioid, the breathing's suppressed, your brain becomes hypoxic, and you die. Access to this level of opiate to death can be as quick as 3 to 5 minutes. Now take that 3 to 5 minute time frame and then apply it to today's healthcare situation in Canada. No disrespect to our frontline health providers. Are you kidding me? They're angels, but we don't have enough of them. What do we hear on TV, television, social media? Delays at ERs, level 0 paramedic services, closure of rural ER departments due to lack of staff. This tool, naloxone, this training, this implementation is more important than it's ever been in history in Canada. Everyone should have a kit. It's a fantastic addition to everyone's first aid kit. Take that information, take the 3 to 5 minute time frame, and then apply it to large-scale construction projects, rural construction projects with one point of entry, temporary elevators. How long does it take to get EMS to someone who's struggling? I can guarantee you it's longer than 3 to 5 minutes. Makes sense, right? Now, death rates, we just talked about this. Someone talked about it earlier. It's bad. It's so bad now that provinces are starting to suppress their data. They don't want to talk about it because of stigma. Terrifying. Over 50,000 people. Guys, this is terrifying. Do you know that in this province, we've recognized this problem for a long, long time? In Ontario, actually, we lost about, 2,500 people in 2022, around 7,500 in Canada-ish, right? But we recognized this problem in this province many, many times, a long time ago. Actually, back in 2016, the Ontario government introduced a naloxone program, free from public health, free from pharmacies. You can walk into a pharmacy and get a naloxone kit. In 2018, they even activated the emergency response system around the opioid crisis. They said, we have to do more. We're actually going to switch to the nasal spray version of naloxone in Ontario. Not the injections, but the nasal spray. You spray it in the nose. Super easy, right? Back in 2018, they spent so much money on this. Actually, it's pretty relevant for today in the current time frame. Do you know that the Ontario government spent the most expensive 30 seconds in advertising around the opiate crisis back in 2018? They bought a 30-second television ad. You know when it was? It's around this time of year. Round 1, Saturday night, hockey night in Canada, Toronto Maple Leaf playoff game, first intermission. There was an opioid ad. It was like, please don't take opioids, carry naloxone. I almost fell off my chair. I'm like, wow, they're really ponying up serious cash here. Good for the Minister of Health in Ontario. And you guys know out there who's Leafs fans why they did not choose round 2. The Leafs never make it. Just saying. Okay. Wow, that really, of all the things I said today, that's what you remembered? Really? Okay, thanks, guys. Now, back then when they spent the money, I mean, I felt like Oprah Winfrey. You get a kit, you get a kit. Everyone gets a kit, right? We get them out. We really try to talk about it. Back then, Ontario's number was only 1,400 deaths. How do we skyrocket? How do we get to the mess we're in now? And as you can tell, our ER data isn't getting any better. This shows ER visits even up to 2023. They're skyrocketing. So back then, in 2012, 2013, when we activated the emergency response system, in 2018, you can see there was a sharp increase from 2012 to 2018. This was the introduction of fentanyl on the streets of Ontario. Bye-bye heroin, hello fentanyl. Then we need to do something. We activated the emergency response system. Everybody got naloxone, and it worked. We started to flatten the curve. Then we were blindsided by a global pandemic. Fear, anxiety, isolation, and access to consistent cash and serve, I'm glad the government isn't here today, led to more overdoses than we've ever seen before. A 62% increase in this province alone, over a 50% increase in the country. Bam, skyrocketed to 3,000 deaths here, almost 8,000 in Canada. So we had to dig out of this mess again. So that's when Ontario announced brand new legislation that I think should be adopted nationwide. The Minister of Labor, a non-health ministry, said, hey, I'm not waiting for you guys to go to a pharmacy to get an naloxone kit. I'm going to make you have them on high-risk job sites across Ontario. Bars, restaurants, academia, and of course, construction was identified as high risk. Now, a 14-year-old kid who works at a McDonald's in the inner city has to have this training. Carrying naloxone, maybe. Phenomenal. But do you think he'll use it at McDonald's? Likely not. But do you think he'll take it to a party on a Friday night where they all do drugs? Maybe. That's the real value. Fantastic initiative. A non-health ministry took the initiative to talk about a health issue like this. I am so thrilled. Now, when we do the overdose risk in construction, there's supposed to be a risk assessment. You're supposed to risk assessment your industry and say, hey, are you guys at risk? Well, does someone use drugs? Did someone make me aware? Don't ask Mark Barnes to do a risk assessment on you. It's very simple. I'll pick up the phone and go, high risk, high risk, high risk, and I'll hang up the phone. Based on the sheer amount of opioids in our society, every single person is at high risk. Do you know that the city of Calgary just started testing opioids in their wastewater from urine output to predict EMS staffing? We're bathed in them. We dispense over 100 million opioid prescriptions in Canada per year, almost 2 per person living. This is a fantastic addition to everybody's first aid kit, not just on a job site, but also at home. Now, when we talk about the construction-specific data, a lot of these statistics have already been identified today, right? We know about the 1 in 13. We know about the 336, 3 in 5, ages of 29 to 50, 98% male, right? But the cross-contamination is real, as you'll see, because the 56% of deaths in this province involved a stimulant, not even opioid, involved cocaine. But the real value in this bill, like I mentioned already, isn't even at work, when less than 2% of the opiate overdoses happen on the job. When is the real value in this bill? It's actually after work, on payday, when you got a big fat paycheck in your back pocket and you want to get baked out of your tree because your boss just made you work 70 hours for the last 4 weeks. That's where the value is this. As in 98% of these overdoses happened outside of the work, and 4 and 5 in a private dwelling. You have to understand the real value in this bill is actually after work, so we can have healthy, happy workers returning to work the next day. That's the importance. Now, when you talk about construction, I can sit up here, talk about my experiences at RespectRX Pharmacy and why I think it's so important. But rather than speaking to me, let's talk to people in the industry with lived experience, as I always advocate for. So this article is a really good one if you want to have a good depiction to read after this. It's Our Times Labor Magazine, right? Written by Megan Kinch. She's a journalist, also an electrician, I believe, worked in the industry. She'll talk about all the things that we already spoke about. Bullying, abuse, right? Lack of empathy and support around treatment. Real problem, and the conversation has to change now. When we look at the data, Megan's stories were actually supported. 1 in 4 people had a healthcare encounter in the 5 years previous to death. If you look at it, actually over 3/4 had an actual injury or pain diagnosis. Okay? 3 in 5 then developed opioid use disorder where they couldn't stop taking them, right? Yet only 1 in 6 were seeking treatment. And that's where the shift's got to be, right? We know people are struggling, yet only 1 in 6 were seeking treatment, probably due to stigma and fear and shame around their opioid use disorder. And we know that the opioids are only a small part of it, as we'll learn soon. And actually 4 in 5 had a true mental health diagnosis. Now, back in 2018, 2019, when we studied the data around the opiate crisis, that's that piece I showed you where we flatten the curve, where we're getting out kids like Oprah Winfrey. The best region identified in this province of getting kids out there, probably the best in the whole country, was here in Ottawa at 38.1 kits per opioid harm. Toronto, you suck again at 4.2. You're like the least offense, brutal. You're on notice. I'm not just here to make fun of Toronto. I really am, though. But I'm not here to make fun of Toronto. I'm here to tell you, despite our large distribution, guys, despite being the best probably in the country at getting kids out there with our public health authority here in Ottawa, we still lost over 60 people at that time frame. Okay? And I'm telling you, those 60 people we lost, those souls, I remember putting pairs of shoes at Parliament Hill to represent those deaths. So I want to know, I never focus on lives saved. I always focus on lives lost. It's a little cynical, but it keeps my head in the game. I want to know, of those 60 deaths, when we drag a body out of an apartment, how often are we finding this? So I asked our coroner's office, when you do an investigation, how often do you find Narcan, nasal spray, Naloxone at the scene of a crime? Right? And they're like, Mark, sadly, only 1 in 4 times. I'm like, brutal. So if I'm the best in Canada, and I'm only batting 25% of the time, how bad is it in Toronto? How bad is it in the rest of the country? How bad is it in places that don't have nasal spray and only the old-fashioned injection? Because the nasal spray version is only universally available from pharmacy and public health in Ontario, Quebec, and the Northwest Territories. That is it. Are you kidding me? So that made us realize that, you know what, politicians, policymakers, maybe the general population, they have no idea who's really at risk of opioid poisoning. See, if you listen to television, modern media, they want you to think that the opioid crisis is a guy with a needle in his arm who's homeless and unemployed at an encampment in Toronto or on the Lower East Side of Vancouver, because that's all they show you, and that's media propaganda. In this province, in Ontario, 68% of people overdose are housed. Over 70% have a job. It's not a homelessness issue. It's not an unemployment issue. It's an everybody issue. In BC, I think one of the coroners there just resigned over the opioid crisis. And they kept talking about East Hastings and Vancouver. And she said, would you stop talking about that? That's less than 15% of our problem. Okay? The conversation has got to change. So who is at risk of opioid poisoning? Well, we mentioned already. We did. We mentioned already about what we think it is. And I told you really what the story is. When we looked at the construction sector, I already mentioned to you guys, over 75% have a pain diagnosis 5 years prior to death. So though the opioid use may end in street use, I can guarantee you where it probably started. Opioid prescriptions. Likely. Right? That's why I hear innovative ideas of pain, opioid-free clinics treating pain and having success, or people who can stop cold turkey. Dude, you stop cold turkey, you are a champion. I know 1 in 1,000 who could do it. And that's the truth. It's insane. Over 1 in 3 people who die of an opioid overdose in this province have an active prescription during the month of death. And I know what you're thinking, really, Mark? In 2024, is there that many prescriptions out there? I know you mentioned that, 100 million, but really, I can't get them at walk-ins. There's no primary care. I can't get them in Emerge. Really, how many is out there? 13% of Ontario adults received an opiate prescription last year. It's insane. But in this province, we have the nasal spray, right? From pharmacy, free. Yet, only 1.6% of opioids head into homes protected with an Naloxone kit. You told me yours was. That's phenomenal. I just outed you. But I know, that's great. Phenomenal. Yet, 98.4% of opioid prescriptions head into homes unprotected without naloxone of any kind. So who's the second group we have to protect? The friends and family of those prescribed opioids. Why? Because we share them. We're Canadian. We're super nice. That's what we do. We're not trying to be malicious in intent. We're trying to be helpful. Man, I've got a bad back. Yeah, me too. Well, we both got to lug shingles up that ladder for the next 8 hours. I got Percocet. Would you want one? Sure. It's what we do. We're not trying to be harmful. We're trying to be helpful. Remember, we're a brethren. We want to support our workers. We want to get the job done. It's who we are. So those prescribed opioids and the friends and family of those prescribed opioids need naloxone. The saddest story I've ever heard doing these presentations was during University of Ottawa during COVID. A university professor disclosed to me that they just lost their 9-month-old niece to an opioid overdose death because she crawled across the floor, got access to a tablet, and swallowed it. Not that one death's more tragic than another, but man, that one's easy and preventable with naloxone, right? Remember, 1 in 3 in the construction sector are those who have a job in this province. It's important. And then the third group are guys near and dear to my heart, the ones we have uber respect for. It's not just our company name, it's actually my mission statement. We know it's a relapsing condition that need mega support. They require naloxone. Yet guys in active treatment who get Suboxone and methadone are only offered naloxone about 40% of the time, and we know it's a relapsing condition. Come on, medicine. It's an open book test. Get it right. You offer naloxone at least once a month. That's the message. But we can't just focus here. As I keep saying, if we focus just on these 3 boxes, which is medical literature, we're going to miss a large piece of information. And this is the most important for every single one of your job sites out there. This is the street perspective around the opioid crisis. So I asked my guys, that last box, I asked them, if I have the opportunity to speak to anybody, what do you want me to tell them? And they right away say, Mark, man, we got a ton of stuff to tell you. I said, what do you want me to say? Like, Mark, you got to talk about tolerance. I'm like, sure. They're like, anybody who does not have tolerance to an opioid in 2024, who walks the streets in Ontario, Canada, require naloxone. Now, you don't have access, you don't have tolerance to an opioid if you never weren't expecting to see one in your body. And that's important to note. Okay? So the person who thought they were doing cocaine has no tolerance. That baby who crawled across the floor has no tolerance. But even if you take opioid prescriptions every single day. You lose your tolerance in 3 days. Okay? And that's important to note. So maybe you haven't taken for a few days because of dementia. You're a senior. You forgot. And then you take too many on Thursday to go to bingo. You'll die. Or someone who can't get in to see their physician because they're so busy at work. And then finally, when things slow down on a Friday, to get in there. But they haven't taken their prescription since Tuesday. They can go home and take their regular dose and overdose. If there's an opioid prescription in the home, we require naloxone. And then, of course, the second thing is other medical problems. We forget. If you're not medically well, you can't handle the opioid. And that's important to note. Okay? Breathing difficulties, COPD, asthma, complicated medication regimes involved in mental health, liver problems, kidney problems, you can't handle the opioid. And then using alone, big risk factor. Those who use alone will die. Why? You cannot use naloxone on yourself. You're already prepped and ready for surgery. Right? Naloxone is intended to be used on somebody else. So those who carry it, those who promote it, should be deemed people savers, not drug users. Yet, in Canada to date, when someone asks for a naloxone kit or carries one, our brain goes, drug user. I've had that experience myself. I've been to a pharmacy in Toronto. I went into the pharmacy proudly and asked for naloxone. I'm like, excuse me, sir, may I have 2 naloxone kits, nasal spray, please? I've already been trained. And the pharmacist's eyes go wide. They're like, they bring me over to the quiet side piece of the pharmacy, private. What opioids do you use? I'm like, none, idiot. The conversation has got to change. Those who carry it, superheroes. I believe the bill in Ontario will make a big difference, and if you bring that home to your province, if you don't live in Ontario, we can make a difference there too. Those that carry naloxone are superheroes, simple as that. And then, of course, the last reason is a previous overdose, and we have a hard time with that. We don't understand how somebody can overdose once, almost physically die, maybe spend a couple days in ICU battling for their life, live thankfully, roll out of the ICU, maybe with permanent medical damage. Maybe they'll never work again. Go back on the street and use the same substance overdose again. We're like, buddy, just stop taking the opioid. What is your problem? But see, what you have to understand is that people who battle with substances, especially opioids, it's not a character flaw. It's not a moral insufficiency. You're not better than them. It's a true mental health condition, hard stop. It's called opioid use disorder. See, people use opioids to kill pain because they're painkillers. I told you that already. But in over 70% of the time, people use opioids to kill mental pain. Of all the substances out there, I'm a pharmacist, of all the substances out there, antidepressants, antipsychotics, I don't care what it is, the best chemical at turning off the brain from trauma and the flashbacks of trauma in your life are opioids, bar none. So if you experience PTSD from military service overseas, you experience childhood sexual assault, abandonment, PTSD in any kind, bankruptcy, marriage trouble, I don't care what your trauma is, and that's battling, and you're battling it every day. It's flashing you back in your face every second you live. Okay, and you want to escape that for just a few seconds in your day, opioids are your best friend. And guys who use it that I work with at our safe consumption services here in Ottawa describe to me how it makes them feel mentally. And they use terms, descriptive literature to describe how it makes them feel. I think I need to share with you. They'll describe to me, Mark, on my worst day possible, my ground zero, when I take the opioid, it's like being filled with liquid caramel. Powerful. They'll also say, Mark, I take the opioid on my worst day possible and everyone's against me. It's like being outdoors on a freezing cold day and someone wrapping me in a warm blanket. But the term used more often than not to describe how it makes them feel mentally is when the whole world's against them. Everybody's kicking dirt in their face. It's that someone's picked them up and given them a warm hug. The hug is the literature used more often to describe how it makes them feel. We can't judge it. They need that hug. The problem is where that hug is the tightest, where the blanket's the warmest, is about 2 breaths per minute. They're almost physically dead. And if you overdose once, you'll overdose again and again and again until you have a chance to get well mentally. That's the message. So we can't judge the overdose, we have to care. So when you think about naloxone, implementing it as a part of your workplace health and safety, carrying it as a person in Canada, think of it as a medicine. Not just an overdose prevention tool, but as a medicine to keep someone breathing until they have a chance to get well mentally, because that's what it is. Simple. Now, these drugs represent our toxic drug supply in Canada. These vials represent how much it takes to kill you. That is a 1-inch ruler on the right-hand side. Right? So those that choose to use it can't control what they're using anymore, and it gets accidentally mixed in everything. That's why we have to know the signs and symptoms of opioid overdose. I'll go over them quickly. I'll show you how to use an naloxone kit, and I'm out of here. Okay, simple as that. First one, and these are ever-changing, but I think we can all identify this. You don't have to be, a medical professional. Simple. The first one is a decreased level of consciousness. Oh, no. You are ready for surgery. I could do a knee replacement on you. You're not waking up, okay? You're out. You cannot be woken up. Second, we used to talk about eyes a lot, pinpoint pupils. Now I stopped talking about eyes so much because they're always rolled back in your head. But right now what you need to think, they're unconscious and they're starting to gurgle. It's like a deep gurgling or snorting sound. It's the same sound you'd make if I took my hands, placed them around your neck and choked you out. Then the lips turn blue and the fingertips turn blue, then the whole face turns blue, the whole hands turn blue. Now blue is a great color and written in most literature, but really only pertains to white people. We are a multicultural society with a bunch of different ethnicities. This diversity defines Canada and makes us awesome. So if you're black, Middle Eastern descent, Indigenous, the color is actually gray. And when we teach this to young adults and kids, they don't see race, they see color. And I can teach a 5, 6-year-old, hey, white guy's blue, black guy's gray. They get it. Simple as that. It's very, very cool and powerful. Okay? So it's blue or gray. You turn blue or gray. We have to update our literature. I skip over limp body. We don't see that anymore. I skip over vomiting. We barely see it. But I go right to shaking. Why? Because the person that's found now, rigid, hands clenched, arms clenched, jaw clenched even, and they're shaking as the oxygen is being deprived from the muscle cell faster than we've ever seen before. So you're unconscious, gurgling, turning blue and gray, and shaking. If you see that in Ontario or you in Canada, anywhere, then you got to start thinking overdose right away. And it's time for naloxone. So what is this stuff I keep talking about? Naloxone. So naloxone is the EpiPen for opioids. But it's a nasal spray in Ontario, Quebec, and the Northwest Territories. And actually can be a nasal spray for anyone in Canada. I ship kits to every jurisdiction and province in Canada. It is free for anyone who's Indigenous status in Canada, and other programs, including Veteran Affairs, cover it. Please access nasal spray. It's way easier to use. Now, the Narcan nasal spray, which we advocate for everywhere in the country, is because it doesn't have needles, it's not triggering, and it's easier to use and more effective. Is the chemical more effective than the injection? No. But I can guarantee you right now, the nasal spray is easier to use than trying to crack an ampule and draw a syringe and inject it. That's for sure. So Narcan nasal spray, the EpiPen for opioids, but it's a nasal spray. Now, like an EpiPen can't remove peanuts from the body, Narcan cannot remove opioids either. All you're doing is reactivating breathing. So it goes to the breathing centers in the back of the head, in the brainstem, removes those opioids out those receptors, allowing the body to breathe. So now we got a tangible tool to keep them breathing until help arrives. Phenomenal. It only takes 2 to 4 minutes to start working. The person could be past breathing, they could be already gurgling or not breathing at all, and it still works. And the devices are stable. The nasal spray version is stable from -15 to +40. Phenomenal for unheated job sites. If it freezes below -15, it's not garbage. It's stable, frozen thawed until expiry date. They expire in about 36 months. Awesome. If it does freeze, it takes 15 minutes to thaw at room temperature according to manufacturers. Or, my guys downtown tell me, it takes 10 minutes in your hand or 5 minutes in your armpit. Take it for what it's worth. Okay? So it warms up quickly. So you keep one in your first aid kit, in your truck, or on the hood, or on the dash in the morning, and you're good to go. I don't know many people who want to work above +40 or -15 anyway. But anyway, needless to say, you can keep it there for everybody. Now, some people are afraid to use it. There's a lot of misconceptions about naloxone out there, that if I use it, they wake up violent and want to fight me. I hear this all the time. First of all, no, they don't want to fight you. But are they agitated and anxious? Yes. They're confused. They weren't expecting to overdose. It's a normal human response. Tell them they've been given naloxone, it helps on the way. And it only lasts 20 to 40 minutes. The literature will say an hour. It does not last an hour with our toxic drug supply in Canada. Okay? It lasts 20 to 40 minutes. The person will slip back and overdose. It is a medical emergency. You must call 911. For those who work remotely and you don't have 911 access, which happens often in Canada, then you have to go to your nursing station, your first aid station as fast as possible. Get someone there with help. But remember, do not be afraid to use this stuff. This is by far the safest thing that I can dispense in a day as a pharmacist. It'll have no effect on someone who has not taken an opioid. So if you think it, you give it. There's the 2 taglines you take from here today. The EpiPen for opioids, if you think it, you give it. So even if the blue lips was a heart attack, the shaking was a seizure, it doesn't matter. You give it anyway, just in case you're right. I tell my daughter, who's now 18 tomorrow, going to prom parties, when you walk into a prom party, just Narcan everyone. You might be right. I sort of mean it. But seriously, it is safe. I've Narcan myself in front of my kids to show them it's safe. Like, my wife called me an idiot, but I did it anyway, just to show them that it's inert. It has no effect on someone who hasn't taken an opioid. So the blue lips is a heart attack, the shaking was a seizure. Even if, like, you don't even know what drug they took, right, guys? Give it anyway, just in case you're right. You've done no harm. That's the message. And that's fully endorsed by every single province jurisdiction, Good Samaritan Drug Overdose Act. It's good. It's covered everywhere. And, of course, in Ontario, we have the second changes to the Occupational Health and Safety Act as well. So, now how do we use it? So there's a 5-step approach to a Narcan nasal spray, how we use it. Step 1, assessment, or not. We know it's safe if you think you give it, but you're looking for unconscious, gurgling, blue and gray, and shaking. Step 2, call 911, or even better, have somebody else call 911. I know you all want a promotion. Be a boss. Have someone else. Staff it out. Have someone else call 911 for you. Okay? If you are by yourself, use the speaker function of your cell phone. Don't wait for that 911 responder to tell you what to do. Grab your naloxone. You peel it open. It's already primed, ready to rock and roll. Okay? It's easy. As my kid says, that's great, Dad, because I'm lazy. It's ready to go. You don't have to do anything besides stick it in your nose and spray it. I can't think of an easier thing to do. You stick it in your nose and spray it. In a kid, it just seals the nostril. In us with big honkers, it goes up to your fingers, you spray it. I'll show you right now, live action shot. Everyone ready? Shoot, 3 feet in the air? Now, it looks like a lot of stuff with the lights and stuff, right? It's actually only 0.1 mil. That's it. Small amount, you delivered it here. Congratulations, but you're not done. See, you've cooked the device. It's single use, already primed, ready to go. It's done. But you've delivered it here. It actually works back here. How do we get it back there? You drive it back there by zapping the guy with an AED, if you have one, or you push on the chest, just like normal chest compressions in CPR. And by pushing on the chest, that drives naloxone from the sinus cavity to the back of the brainstem for it to work. And then you will hear the most glorious sound you hear in any overdose reversal. And I've heard it 11 times myself. You'll hear this. A deep breath. Right? That's how you know it works. If you do not hear that deep breath in about 2 minutes, then you know you need more. So you grab the other spray that you have in your kit, because every kit comes with 2 sprays usually. You should have more than 1 kit around. You need actually 4 or 5 sprays around. You spray it again. Then you do chest compressions again for 2 minutes. It doesn't work, you grab another spray. Chest compressions again. So it goes spray, chest compressions for 2 minutes. Spray, chest compressions for 2 minutes. Spray. You keep going that rotation until you hear that deep breath. A paramedic tells you to stop because they're going to take over, or you run out of naloxone, in which case you do normal CPR till help arrives. That is it. That is all. Simple as that. So by a show of hands, with the nasal spray version, with the process I showed you, how many of you guys think you could act in the event of an acute opioid overdose, especially if it was a loved one? All right, give yourselves all a round of applause. You're superheroes. Congratulations. Now, in Ontario, for those of you from here, there are community pharmacy programs to get naloxone. Those of you not from Ontario who want nasal spray, and you're in Ontario today, oh, actually we're in Quebec, but Ontario is just over the river. In case you didn't know, just over the river is Ontario. Go and get it today. Go to a pharmacy and ask for nasal spray naloxone and take it home. Then don't tell the Minister of Health I said that. But do it. It's so important. The nasal spray version, from my experience and expertise, decreases barriers and allows people to want to help. Very, very important. You can also order it directly from me at RespectRX Pharmacy. We support companies right across this country. I would love to help you out with very, very good pricing. I'll make you a great deal. All right, guys. And the last thing I want to speak about is something that's very important. As people still struggle in the darkness, as people still have a lot of stigma and fear until they get the bravery to speak about their problems, right, like so many people do, they will use alone. And of course, using alone is one of the biggest risk factors. So this here is a resource for you guys called NORS, the National Overdose Response Service, made from the wonderful folks in BC, okay, made with the Brave app. You can dial this phone number, or you can download the Brave app on your phone. Just Google Brave app. And that's for people who are using alone. They don't have to anymore. They can actually use it with someone electronically. And if they don't respond back, they'll actually send EMS to the PIN location of the cell phone. This is a free service anywhere in Canada. Check it out. It's called NORS. These people save lives every single day. And the last thing I say before I leave, and I want you to take with you every day, is ask not why the addiction, but why the pain. Thank you guys very much.
Thank you, sir. Good job. Thank you very much, Mark. I hope we are all able to take away some potentially life-saving information from that presentation. Looking out for one another is the kind of the hallmark of being a part of a union. And I hope you never have to use it, but knowing how to use a Naloxone kit can be empowering, not just for our industry, but all industries. Thanks again, Mark. Thanks very much.
Thank you, Mr. Chairman. I'd just like to echo our thanks to Mark. It's really inspiring to see healthcare professionals with such compassion for this very serious issue. So we thank you for your dedication and for sharing your message with us here today. Before I introduce our